Today we are discussing the enteric nervous system. Dr. Thomas Kuchenbrod struggled with severe ulcerative colitis for years. This ignited his passion to help others with IBD. Dr. Kuch has a Doctor of Chiropractic degree from the prestigious National University of Health Sciences. He is also the president of business development for Crohn's Colitis Lifestyle. Welcome, Dr. Kuch.
Thank you. Yeah, I'm great. I'm really happy to be here, and I'm really looking forward to our conversation today.
Me too. And we did a live together in September. That was so good. You guys have to check it out. It's on Root Cause for Crohn's Colitis, that Instagram live. And Dr. Kuch goes into his story, really delves into the ulcerative colitis story. And then we also talk about your passion for helping others. So check that out too. But today we're talking about the enteric nervous system. So Dr. Kuch, could you tell us what is the enteric nervous system and how does it relate to IBD?
Yeah, that's a great question. The enteric nervous system, it's an exciting topic for me because I love the nervous system as a whole. And in our culture, or the general population, it is sympathetic and parasympathetic, and that's it. The enteric nervous system is a little misunderstood, not even misunderstood or overlooked, but just not really known. So there's a nervous system within the digestive system. It's called the enteric nervous system. It has about the same number of neurons, because there's not exact, but roughly the same, if not more neurons than the amount of neurons in the spinal cord. That's how big it is. And it's because the digestive system is so big. If the surface area of the small intestine is about the size of a tennis court, and all of that tissue needs to be innervated by nerves. Now, in the enteric nervous system too, there's many layers of the digestive system. There's two main plexuses. So you can look at the whole digestive system, multiply it by 2. You also have it kind of in some of your accessory organs to help with digestion. So in the enteric nervous system, it's a specific branch of the nervous system directly found in the digestive system. And what it does is it allows the digestive system to operate. It helps control, there's many factors, but it controls digestion, absorption, secretion, hormones. It interacts with the microbiome. It plays a role in everything. Because when you look at how the body communicates, it communicates to itself in many different ways. Hormones, fascia, nerves. But nerves control just about everything because they are what control blood vessels. They are what releases hormones. They are what causes smooth muscle contraction. Like peristalsis in the digestive system is controlled by the enteric nervous system. So the enteric nervous system, it's an exciting newer discovery in health science. Obviously, it's not like 5 years old, but it's kind of like the microbiome a little bit. I would put the microbiome kind of here and the enteric nervous system here of understanding and our ability to positively influence it and really have a good understanding of what it does. But the more and more we learn, the more and more we know how important it is and how it not only affects the digestive system, but it affects the entire body. Because when you affect the gut, you affect the rest of the body. The second brain sometimes is more like the microbiome people think, but I think of it more as the enteric nervous system because it is nervous tissue and it's so complex, very, very similar to the brain. And it plays a role. It's really plays a big role in the microbiome, in all of this, so it's all connected. But that, in short, is what the enteric nervous system is.
And it's so important to IBD. It really is. Everything you described. And when we had discussed topics for this episode, you had brought this up and I said, okay, I've heard of it, but I don't know much about it. So the fact that exactly what you said, it's so unknown and we really need to know more about it. It's so fascinating. I mean, even for peristalsis alone, which is a huge thing for people with IBD, as you very well know. I mean, just that factor of it. So it's amazing.
Yeah, and peristalsis, for those that don't know, that is smooth muscle contraction within the digestive system that helps move the food bolus or chyme along the digestive tract, from mouth to the other side. And even something like that, the best way to visualize it for me is like when a snake eats a mouse. And you kind of see the mouse go through the snake. That's what it looks like in the intestines.
Good visualization.
But even something like that is a lot more complex than you might think. because it squeezes and loosens, squeezes and loosens. Your nerves need to know what smooth muscle to squeeze to push it along, but at the same time inhibit the other ones and make it loose so it doesn't go the other way. And like you said, it's highly important because if you're not moving chyme or food along, then it's not going to get through the system. Can lead to constipation, can lead to cramping, can lead to all of these more symptoms, which a lot of people listening know well.
You keep saying a word that I'm not familiar with, chyme?
Yeah, that is like it's like food when you put it in your mouth and then it goes into the esophagus and the stomach, and then the acidity breaks it down into like a food bolus, or chyme is like kind of the word to describe what's actually going through the digestive tract. Because once it gets to your small intestine, it is chemically and a lot physically different than food.
Okay. Oh, thank you for explaining that. That's good to know.
Yeah, no problem.
Like in CIRS, chronic inflammatory response syndrome with the HLA gene, are we predisposed to having a damaged enteric nervous system, or does it become damaged with life events?
Yeah, that's a good question. There's not much. I was looking into the gene aspect of it. There's not much knowledge of genes' role within the enteric nervous system. And I think that is because there hasn't been much focus on it. Kind of like the microbiome or a lot of the things we discuss about. It's not an area of focus right now in research and medicine and things like that. So there's not much information there. We can make assumptions. We can look at epigenetics and things like that. Genes are really not my wheelhouse. But the second half of that question is really spot on, and we know that, and we see it with the rest of the nervous system. I think that's a big advancement within the last 100 years of medicine, as well as knowing that it wasn't that long ago we thought genes was everything. And that's why everyone smoked, because it doesn't matter, right? You're just, that's what everyone does. It's your genes that dictate your health. But the more and more we learn about environmental factors, the more and more we understand how important they are for your health, for all types of things, even things you might not even think. So, especially when you look at the nervous system, because something else that's important about the enteric nervous system, it's a separate branch. Necessarily need innervation from parasympathetic, sympathetic. I can't say that confidently, but it's a separate branch. It's not parasympathetic or it's not sympathetic, right? But it is influenced by parasympathetic and sympathetic. So I assume a lot of people listening to this can see how environmental factors affect your parasympathetic and your sympathetic, which then downstream infect your enteric nervous system. So environmental factors are a huge role. And it's very similar to your central nervous system or peripheral nervous system on how that can happen. Stress is going to increase sympathetic and decrease parasympathetic. So what's that going to do? That's going to focus less on your vagus nerve activation in the gut, which is huge. Everyone talks about the vagus nerve with the gut. And it's like, with the vagus nerve of the gut, what is it really influencing? It's influencing the enteric nervous system that can then secrete, cause muscle contractions, digest, absorb, things like that. So if you have increased stress, or a lion walks in the room, that's going to go way down, and your sympathetic's going to go way up. And in the digestive tract, you can really think as parasympathetic as the on switch and sympathetic as the off switch. So when parasympathetic is high, you're going to release hormones, like you're going to get hungry. You're going to break down food better because you're going to release more enzymes. You're going to absorb better because your blood vessels are actually going to dilate. The enteric nervous system, it innervates the blood vessels within the digestive tract. So your blood vessels are going to dilate. You're going to get more absorption. You're going to release more, which is also really important. I know you talk a lot about toxins, especially within the gut. So parasympathetic is turning on, and sympathetic is turning off for simplicity. There are some examples that kind of don't follow that rule, but to simplify it, parasympathetic on, sympathetic off. So when outside factors disturb that, then you're going to lead to maybe lower digestion, lower absorption, not being able to secrete as many enzymes as you'd like, which of course leads to the lack of full breakdown of food, and food gets lower in the digestive tract, and you have these downstream effects. So environmental factors are huge, and there's hundreds, probably there's thousands of examples of those. So yeah.
Okay, perfect. So it is life events that do absolutely affect it, as you're saying. And we're dropping this episode in early December, and in October, so 2 months ago, I went through 2 weeks of just really bad stress. I had these life events happen. It was 4 in a row, and it was like boom, boom, boom. And I immediately noticed, my digestion wasn't that good. I noticed that I didn't have the green hearts or the perfect poos I like to have, all that kind of stuff. And it really does take a hit. And now I know how to get myself out of it. But I agree, it's a lot of life events that come into play. And then on top of it, like you said, you have the environmental factors, so the physical and the emotional together.
Mm-hmm. Yeah, and chemical. So it's like, I try to simplify it for clients or patients, there's really 3 root issues: chemical stress, physical stress, and emotional stress. So when those 3 become too high is when your body's going to become overwhelmed, when your nervous system's going to start to not operate as physiologically optimal as it has in the past, and lead to those downstream effects. So, it's all important, and it'll be different for different people, or different for the same person in different seasons of their life. So yeah, it's, there's a lot to break down there, but
it is a lot to break down, and it's good we're breaking it down so people know.
We're trying.
Yeah. Right? So what are gastrointestinal hormones?
Okay, great question. So hormones within the GI tract. So, there's, like I said earlier, there's many ways that the body communicates with itself. And a lot of this is things we take for granted. It's kind of like your hands. Like in high school, I broke my right hand. And then I didn't realize how hard everything in life is without your dominant hand. Something like brushing your teeth, you don't think about it. And the health and body is kind of the same way. Is like we learn about hormones, but we don't ask those second, third degree questions. So hormones are really important in the gut for many reasons. And they're really important when we talk about the enteric nervous system, because the enteric nervous system is what releases the hormones, or allows the body to know to release the hormones, the glands. There's many glands on the digestive tract, and these glands can be responsible for producing and releasing the hormones. So a good example is ghrelin. Ghrelin is a hormone found in the digestive tract. It's excreted, and it creates hunger. So if we were talking before we started the podcast about breakfast, I haven't ate breakfast yet. So now that I'm kind of talking about food, I'm starting to get hungry a little bit, and it's, and that's just thought. But if I were to see something, if my wife were to come in the kitchen and, make some eggs and maybe make a smoothie or something, then I would get even more hungry. If I smelt it, I would get even more hungry. And I'm getting hungry because my digestive tract is releasing the hormones in the digestive tract to know, okay, I'm hungry, I'm ready to go. And it prepares the body. So hunger is actually really good in a sense, because when you're hungry, you're going to digest and absorb better because your body knows it's ready. The opposite is the same. So yesterday I drove from Los Angeles to Oregon, and I ate in the car, which is not optimal. Because when you're in the car, you have higher sympathetic response than parasympathetic. So, you're driving, you're watching cars, things like that. Even though it's just a protein bar, I'm not going to digest that as well as if I was in nature and relaxed and hungry coming in. My body's going to just absorb that more optimally. So hormones are really important for instances like that. Same thing with secretions and enzymes. Hormones allow your body to know when to digest those or when to release those. And then they communicate to your body through the enteric nervous system to release them through loosening the sphincters of like the gallbladder, the pancreas, to release the enzymes. So, when you look at hormones, they play a big role within the digestive system in many ways. And I think one thing that's important with the hormone talk is the understanding that they're created in the digestive system, in the gut. And when you affect the enteric nervous system, you're affecting how those glands operate. So, it's an important conversation. Also, like gastrin is a famous one, or not a famous one, but in maybe anatomy and physiology, it's one of the first ones you learn because it's really involved with the acidity of the stomach. And the acidity of the stomach is really important because if your stomach's not acidic, then things aren't going to properly break down, and that chyme in the small intestine or the food that enters the small intestine won't be in the state where it should be, which leads to all types of downstream effects. Maybe not absorbing the food as well because it's not digested as well. Maybe pathogens like H. pylori or some of these bad bugs get into the small intestines and aren't killed by the acidity in the stomach. Because that's one thing that's beautiful about the stomach is if when the acidity is high or where it should be, it kills these pathogens coming in. But if that acidity is down and it's more alkaline, I guess you would say if that acidity is up and it's more alkaline, you would have these pathogens be able to get in the small intestine and then be able to multiply and things like that. So gastrin is a really important hormone. So hormones are really important throughout the digestive system. They all play different roles, and they're similar to nerves, and they're involved with so many functions that we just don't think about, like breaking your hand.
It's complex. This system, this digestive system, this microbiome is much more complex than we ever realized, especially in the past, 10 years, what we've come up with. So talking about it as the microbiome, as a place that kills pathogens, as a place, that has hormones, it's amazing to think about, right?
Yeah, it is. I describe it a little like space to some people. It's like, we can see it, we kind of get it, but the further we go or the more we see, it's like the more questions we have and the more we understand how little we do know. I think that's important to know is like how little we do know, because I think a lot of errors in medicine have come from the belief that we do know certainty. There's still physicists today trying to find loopholes to gravity. There's still, people trying to disprove gravity or things like that, and that's kind of like the scientific method is continuing to go. And sometimes when we look at the body, we think we just know. And smoking is a good example, or looking at the appendix, which is, kind of a hot topic. There's so many examples, but we know very little, not only about the body, but, about a lot of things in life.
Yeah. And it's fun to explore. So
It
I
is.
want to, for you actually, I guess for me too, but definitely for you being a doctor. I want to move on to the healing portion of this. So how can we heal the enteric nervous system?
Yeah, so it's kind of same as earlier when I was talking about the parasympathetic and sympathetic. That is probably the best way to focus on specifically the enteric nervous system, is focusing on parasympathetic over sympathetic, which comes with the chemical, physical, emotional health and improving those. And, like the vagus nerve. Everyone I'm sure you've had many, I wonder what the percentage of people you've had on talk about the vagus nerve within the gut is, but it's probably pretty high. Mm-hmm. So, all those vagus nerve interventions are really, really good for the enteric nervous system. Now, something else that's important, though, is hitting it from the other angle, is trying to help your enteric nervous system by assisting it as much as possible. So like I was saying was when you're eating, that's more in parasympathetic, try to be relaxed, try to be happy, things like that. But, maybe if you're struggling with digestion, you could talk to your doctor about taking a digestive enzyme to help release some artificial enzymes to help break down the food, to take some stress off of your body, because the enteric nervous system might be not communicating as well with your pancreas. And you can assist your body and allow it to kind of give it time and space. You need time, space, and energy to heal. So same thing with the enteric nervous system. Give it some support. That way, as the chyme goes down, even though it wasn't have as much natural digestive enzymes, it has some artificial to help break it down and the downstream effects aren't as bad. So I kind of view it in two main ways. One is you can support the enteric nervous system by helping all the other functions in the digestive tract. Digestive enzymes, that's a kind of a simple example. And then two is focusing on parasympathetic and sympathetic. Now, when I talk about parasympathetic and sympathetic, I try to always state that sympathetic is not the devil. A lot of people want to shut down sympathetic, which I think is a big mistake. You need sympathetic to live. It is really, really important. So
To survive.
to survive, yes, you absolutely do. And so when I say parasympathetic, sympathetic, it's not like you don't need to be scared of sympathetic. You just need to make sure your parasympathetic is operating and it's at the right time of the day and things like that. So those are the two main ways that you can influence and help your enteric nervous system function.
Perfect. And I wrote this down because I love it so much. You said you need time, space, and energy to heal. That's so great. Where'd you come up with that? That's really cool.
I'm not sure. Obviously I work with Dane, and I think he's might have said that in the past. I've heard someone say time and energy, and I think it was him. I think it was Dane. I'm not 100% sure. I've kind of involved and added energy onto that when I talk to people, and I don't say it much. So time, energy, and space. Time. I don't even know what order I said it in, but time, space, and energy. You need all those three things. Even if you look at a plant, the plant needs space to grow. It needs time, and it needs energy. It needs the sunlight. So yeah, time, space, and energy.
Yeah, I like that. That's really good. I'm going to keep that in mind because I also think of it as space, as holding space for ourselves and giving ourselves permission to heal and allowing that instead of punishing why aren't we healing fast? Why is a mold not out of my body in a year? Why is it not out of my body in a year and a half? Instead, giving yourself that space. So I really appreciate that. So thank you. Thank you so much.
I'm glad you're able to pull that out. I said it, but I wasn't thinking about it. But it's a good reminder for a lot of people, I think, time, space, and energy.
Yeah, you should make a t-shirt.
I should. Yeah, maybe I will.
You guys should make a t-shirt over at Crohn's Colitis Lifestyle and sell it. It would sell. Or a sweatshirt. I think that would be cool. So anyway, thank you so much for coming here today. I always love talking to you. You're such a bright light in the community, and
thank you.
You're so wonderful with serving others, and we all appreciate you. What would you like to promote today? Any website, anything like that?
Yeah, anyone can reach out to me. I'm pretty accessible on Instagram. My email is drkuch at crohnscolitisLifestyle.com. That's DRKUCH at crohnscolitisLifestyle.com. Feel free to reach out. That's just the best way to get connected. I do intro calls, or I can set you up with a free call with a team member. Both of those are acceptable, and just get connected. I'll, try to continue to produce things on Instagram and things like that. Of course, I work with Crohn's Colitis Lifestyle and fully involved, and that's my full-time role. So our Instagram page is tremendous. Anyone that hasn't seen it, we try to continue to put more and more valuable content out there, and the next 6 months it's just going to be more and more, and we're growing fast. So continue to follow us as a team, continue to reach out to me any way you want to get connected. Just let me know what you need.
Okay, perfect. So we also want to wish you happy holidays.
Yes,
because this is the holiday season. Are you doing anything fun or exciting?
Yeah, that's good. So I'm on the West Coast. I've been out here for almost 2 months now, and it's my wife and me and my wife's first time out here. So it's been a great time. We came out once. I came out to see Dane for a week a couple years ago in LA, but we've been on the West Coast. So December 18th, we're headed back to Charlotte, North Carolina, to home. Both of our families are there. So our plan is to go back, spend some time with family. Christmas is really, really big in my family.
Nice.
It always has been. So I'm really excited to get back and, Christmas, Hanukkah, whatever season someone's in. Really love this season with, connecting with family, slowing down, kind of relaxing, and getting ready for the new year, which really excited for 2025. Not only for me personally, but with Crohn's Colitis Lifestyle. A lot of exciting things planned, and it's going to be a great year.
I agree. I think in IBD in general, there's going to be a lot of new discoveries and a lot of things propelling forward and people talking a lot more about the root causes and talking about it correctly. So I'm very excited about that. So happy holidays. And you know, Dr. Kuch, how I end every episode is I wish everyone a Green Heart Day, and that is a perfect poo. So if you could just wish everyone a Green Heart Day.
I wish everyone a Green Heart Day. Yeah.
Thanks, Dr.
That's awesome.
Kuch. All right, take care.
Thank you. Bye-bye.